Okay, everybody, good morning. Here we are. Health is Wealth with Dr. Jack Kalra, hosted by Jyoti Gupta. As you all know, we changed the time, and I think everybody sent us messages. They like this time every Thursday at 11 a.m. So that's good morning. You can hear and then you're done. Then you can follow what we teach you here, right? So as you know, last week Dr. Jagji and Beena Kothari were there, and they had a very good session of leg pain. So today also we are continuing leg pain part 2 with Dr. Jag Khalra, who's oncologist and breast cancer specialist, and with lots of experience, she can answer your any question. So here we go, and we will also issue the video YouTube, and then you can also see later on, or any question you have, you can ask on Facebook Live on Health is Wealth page. So welcome Dr. Jak Khalra ji. Aaiye. Before I
Good
say,
morning,
before I forgot, today is our friend Dr. Javeri's birthday. So we wish him happy birthday. Okay.
Oh, very nice. Good morning, Jyoti ji, and good morning, all the friends. We changed the time because it was Happy Diwali, and then we decided Thursday is better day to take care of our health. मंडे को उठते हैं, थके हुए होते हैं, वीकेंड खत्म होता है, क्या है हेल्थ को क्या देखना. By the time Tuesday, Wednesday come, we are already tired, and we should definitely take care of our health. So happy Diwali. I hope everybody had a good Bhaiya Dooj, Lakshmi Puja, lot of money. So let's concentrate on our health. इससे पहले कि मैं आगे चलूं, it's still October, so we have to remember it's the breast cancer awareness month. Please, I request and urge all of you women out there to have a mammogram done. Send your family. If there's a history of breast cancer in the family, in the mothers, grandmothers, everybody over the age of 40 should have a first mammogram. 35 if the younger mother had a breast cancer. So please, 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 very, very important. And also just remember that our COVID is still there. It's not completely gone. It's much better. We are free in our society, but please take your vaccination if it's available to you and follow all the rules. There are new antivirals available, but consult your doctor, not Google, if you want to take a medication. Because some people come and say, just give it to me. No, there are side effects to everything. So please take precautions. So now let's start the leg pains.
Yes.
We did discuss leg pain, and we all know legs are very important part of our body. Even though God gave us two legs. Can you imagine just one leg we are working on? No, some people are born with one leg. It must be their hard life, but thank God we have two legs. We got to keep both of them healthy. Don't prefer right over leg. It's like your children. You like all your children, like both your legs. I'm just having some fun. So the legs are made of not just one bone. See, sometimes mind only says, oh, legs is bone. It's not a bone. It contains muscles. It contains tendons. And overall, very important is to remember it has circulation. Circulation is of three types. One is the arteries that bring good blood to the whole body, including the leg. The other is called the venous blood that takes the blood back to the heart to be purified. So the purified blood comes to the legs, which supplies the legs, make them healthy. Unpurified blood, after it is used in the legs, goes back to the heart to be purified. And there is third kind of circulation called lymph circulation. Lymph is a light whitish fluid with some electrolytes that is in everybody's system. That is like a waste fluid that goes back from the legs back into the circulation and becomes a part of blood. It's whitish in color. It's not red. Whereas arterial circulation is bright red. Venous circulation is bluish red because it has carbon dioxide and lactates and everything. So now we know that we have so many parts of leg. And very important is the nervous system, which is not a circulation, but it's nerves. If the nerves don't work, no, the whole body doesn't work. So nerves are connected to our spine and connected to our brain. So brain is very important part of leg pains. Some people just have leg pains because they're thinking about it. I'm tired. I'm tired. I have leg pains. So it's called mental pain, or I also call when you're depressed and you don't like things around you. You don't have good friends like I have, like Jyotiji have, and you don't have make yourself enjoy life. Then you're tired all the time. So that tiredness is not exactly leg pain. It's a whole body restlessness and anxiety. So it's a different part. So let's concentrate on our legs. Uh, who has not had leg pains at night, like a leg cramp, Jyotiji? Can you imagine when you get a cramp in the leg?
I think very
It's so
popular thing.
painful.
Yeah.
It's called Charlie horse or a leg cramp. And a restlessness syndrome is a little bit different, where there's a pain where you can't keep the legs in one place. You're twisting your legs this way, that way, and you can't sleep. So if you don't get a good sleep, the whole day is bad. So there are leg pains which come as a sharp shooting pain. That's called Charlie horse or a leg cramp, which may be just due to electrolyte imbalance. So now we are talking about causes of leg pains.
Jagji,
I'm
before you start more, I just want to share something. आपने बोला रात के टाइम कई बार cramps वगैरह होते हैं. So what I do, I get up and I walk little bit. Then it's okay.
yes, absolutely. So चलिए हम ये लेग क्रैम्प के ऊपर उसका थोड़ा सा बता देते हैं ट्रिक क्या है. Like she said, either you can get up from the bed and walk and stretch the leg in a opposite direction. जो calf muscle होती है ना, behind the leg is the major, one of the major muscle in our body. When that get cramps, it's a severe shooting pain. तो हमने उस मसल को ऐसे हो रही है उसको रिलैक्स करना है. तो हम we take our foot and we go in the opposite direction and we massage that thing. Sometimes that can take 1 minute to 5 minutes and it is seriously painful. So at that time you really rub it very tight, put the foot like that. And a trick that I've learned over the years is you put your opposite hand. If your left leg is having a cramp, with the left hand you put the foot in a flux, means in front of you position, and put the other arm all the way up. Jyoti ji try kariye, all the way up. So पीछे से सारी spine muscle and the gluteal muscle, बटक की muscles relax होती है. That nerve goes to the calf muscle and it really goes very fast release. So try that. And इससे पहले सोने से पहले ही आप थोड़ी सी स्ट्रेचिंग करके सोइए वो calf muscle को, because during the whole day they are being used. हर वक्त हम चलते हैं, दौड़ते हैं, exercise करते हैं. We're using our calf muscle that builds up lactate. Lactate comes from muscle burning and muscle using them. वो lactate जो होता है that makes the legs tired. So stretch the muscles. Some people do warm bath at night, that helps. Some people do the vibration kind of massage, that can help. Warmth helps to relax the muscles at night. So you can relax your muscles before you go to sleep. And there are other tricks are there. Maybe the legs are getting cramped because you're on some medications. So there are some medication that can cause electrolyte imbalance. So electrolyte imbalance, what are the electrolytes that can cause leg cramps? Number one is potassium. If you have a low potassium because you're taking some diuretics, water pill लेते हैं ना, heart के लिए लेते हैं, swelling हो जाती है leg उसके लिए लेते हैं. So low potassium can cause leg pains. एक तो remedy है bananas are very rich, orange juice is very rich in potassium. You can take that, everybody can take a little bit of early in the morning. So the second cause of that electrolyte is calcium deficiency, hypocalcemia. Again, that can be from the medications. It could be from thyroid problem. It could be from the bone problems. Your calcium is less in your system. So that is another to be kept in mind. So the food rich in calcium are milk, eggs, and a lot of fruits. Fruits are good for everything. And the third thing we can lack is magnesium. Magnesium जो होता है वो भी medication के साथ में ही low होता है. Or if you're exercising the whole day too much, you're using your magnesium. So not, I'm telling you to go and get your blood checked, but you can take some, broccoli kind of thing, which are rich, cauliflower is rich, fruits like raisins are rich. So these are the things. So phosphorus is very rare, but it can be low with the people who have some kidney problems. So problem ke saath diabetes, kidney problem, hypertension, and there is a one called peripheral vascular disease. As we get old, our arteries get narrowed, calcium gets deposited, which is a process. You can't stop it completely, but you can lower it, your chances of getting a peripheral vascular disease by controlling your cholesterol. Very important, this is low density cholesterol. HDL, high density, तो हम सब ने सुना हुआ ना, which is a good cholesterol that comes from exercise, that comes from eating good food, less kind of oily, saturated fats and everything. Whereas low density cholesterol हमारी body बनाती है. So I don't know how much control we have. If the अभी पहले था उनका level 100, now they want us to go to 70. So 100 से 70 आना, it's not easy. So again, exercise, nuts खाइए, और कोशिश करिए कि तला हुआ खाना नहीं खाए, वो तो हम रह नहीं सकते, but we can lower it. And so that's how you decrease your LDL. So increase your HDL, lower your LDL. So ये तो हमारे cardiologist का कहना है. But if as we age and we can control it, we need to take medication. So don't be scared of the medication. Medications have problems, but they have more benefit. If the benefits are more, then you have to adjust to the side effects, or I would say ignore them sometimes. तो चलिए ये तो हो गया इलेक्ट्रोलाइट इम्बैलेंस, वेरी वेरी इंपॉर्टेंट, आई एम नॉट इग्नोरिंग. अब सर्कुलेशन पे आते हैं. सर्कुलेशन, एक तो हमने पेरिफेरल वैस्कुलर डिजीज की बात करी, वेरी इंपॉर्टेंट, तो वो हमने खुद को कंट्रोल करना है. Other kind of circulation is venous circulation. I talked about that the blood comes back from the foot into the heart. Some people are born with tortuous veins, means dilated veins or big veins. वो हमारे control नहीं है. Other time when you get those big veins is during pregnancy, or if they anything pressure, putting a pressure in your pelvis, which is the lower part of the abdomen, and pressing the veins, they are major veins. तो जो blood है वो वापस नहीं जा सकता. So you will see some people have bluish marks on their legs, a lot of them, and they are dilated veins. तो अगर जो veins ठीक से काम नहीं करेंगी तो blood stays there, and that can cause pain in the legs. So if you have that kind of problem, then the solution is आप रात को अपनी legs थोड़ी सी ऊपर रखिए, और अगर बहुत bother करता है, then you gotta go to the vascular doctor, because they can do some kind of venotherapy, और वो veins को shrink कर देते हैं और वो better हो जाती है. लेकिन if there is, you have a pain in the abdomen, the legs are connected to the belly. अगर कुछ पेट में प्रॉब्लम है, दर्द होती है, some problem है, and it's pressing on the veins, then you need to figure out what's going on in your pelvis. And one of the important causes is a natural cause is pregnancy. जब प्रेग्नेंट होते हैं तो वो वेन्स के ऊपर प्रेस करते हैं. आपने देखा होगा कई लेडीज की वेन्स बड़ी प्रोमिनेंट हो जाती हैं, एंड राइट आफ्टर प्रेगनेंसी ठीक हो जाती है, कईयों की नहीं ठीक होती. जब नहीं ठीक होती तो फिर पैरों में स्वेलिंग रहती है, कभी आपने देखा होगा पैरों में स्वेलिंग रहती है, तो उसके लिए फिर आगे टेस्ट कराने पड़ते हैं या कुछ कराने पड़ते हैं. तो ये हो गए हमारी वीनस सर्कुलेशन. जो थर्ड हमने बताया लिम्फेटिक्स होते हैं, थर्ड टाइप ऑफ पाइप्स जो होते हैं. तो वो जो लिम्फेटिक्स होते हैं वो कैसे, वो हमको दिखाई नहीं देते बिकॉज दे आर व्हाइटिश इन कलर. सो यू डोंट नो दैट, इट ओनली शोज एज ए पार्ट ऑफ स्वोलन लेग. आपकी लेग से वो ठीक नहीं हो रही है. ये क्या हो गया, मेरी टांगों को अच्छी भली थी, आप सारा दिन खड़े रहते हैं, आप जो मशीनरी ऑपरेट करते हैं, दे आर स्टैंडिंग द होल डे, सो देयर lymph glands don't work properly. And the other important thing is we all have lymph nodes. Lymph nodes जो होते हैं ना, वो stop station होते हैं lymphatics के. lymphatics आते हैं, वहां पे रुकते हैं, फिर वापस में एक ग्लैंड बोलती है, स्टमक के बीच में होती है, उसमें जाते हैं, फिर वापस लंग्स में जाते हैं. So if the lymph glands are swollen or big for any reason, whether it's an infection, whether it's some kind of cancer like a lymphoma, it gets very big and it stress is on the lymphatics. So again, leg swelling हो सकती है. तो उसके लिए हमने क्या करना है? You cannot do anything. You go to the doctor, see if you can have some surgery. If you cannot have surgery, then you have to get some kind of medical treatment, or you have to give chemotherapy if it's a lymphoma. Let's not even think about it. So ये हमारी हो गई circulation की. एक very important circulation की बात बताऊं, trauma. हम आज trauma की बात नहीं कर रहे, fracture की बात नहीं कर रहे, tendon rupture की बात नहीं कर रहे, क्योंकि वो हम last time कर सके थे. लेकिन जब trauma होता है और आप एक जगह बैठे रहते हैं बहुत देर, this I cannot stress enough. If you're sitting in the car for more than an hour or definitely 2, if you're more than 50-year-old, there is no harm in taking baby aspirin before you start your journey. If you're going to an aeroplane, sitting more than few hours, take a baby aspirin, and every hour get up and move your legs, because these calf muscles have a lot of blood supply and big arteries and veins. आर्टरीज क्लॉट होना बहुत कम होता है, लेकिन वेन्स जो होती है ना, वो कोलैप्सिबल होती है, मीन वेरी वेरी थिन स्किन होती है उनकी. वो ऐसे ब्लड जब उसमें सर्कुलेट नहीं करता स्लो, उसमें क्लॉट बन जाता है. क्लॉट बन जाता है तो वो जो क्लॉट है वो पेन करेगा, स्वेलिंग करेगा, रेडनेस करेगा, नॉट राइट अवे. आपको कुछ पता भी नहीं लगेगा, आप कहेंगे अरे थोड़ी सी दर्द है, क्या है, होती रहती है. लेकिन अगले दिन या रात को आप देखेंगे आपकी टांग में इतनी पेन है और समझ नहीं आया क्या हुआ, मैंने तो कुछ एक्सरसाइज नहीं करी, कुछ नहीं, एक टांग में दर्द है. यूजुअली इट्स ऑलवेज इन वन लेग, बट you know, sometimes if there's something in the belly pressing both legs, then it could be both leg problem. So as soon as you see कि ये मेरी टांग को क्या हो गया, क्यों नहीं हिल रही, and the pain sometimes goes up into the thigh, that is a sign of a DVT or deep venous clot that needs to be taken care right away. तो आप urgent care में जाइए. Usually people diagnose it very quickly. They have what is called ultrasound or Doppler. उससे वो ऐसे trace करके sound से they can see that where the clot is. You get an anticoagulant, mean the drugs that try to dissolve the clot. आजकल तो by mouth देते हैं, PO pills दे देते हैं. Otherwise olden days में तो इंजेक्शन देना पड़ता था, हॉस्पिटल में एडमिट करना चलता था. लेकिन अब अनकॉम्प्लिकेटेड क्लॉट के लिए they just tell you to keep your leg elevated, take some baby aspirin because aspirin is a blood thinner, and give a rest to your leg. And anticoagulant usually works within 2 to 3 days. Within 2 days you see the swelling is down. So don't ignore the sudden pain in one leg.
Yeah, Jagji, I want to share something with you. My son was in medical college, and 10 years ago, I was sitting in the Mata ki chौकी for more than 3-4 hours, और उसके बाद मेरे blood clot हो गया और दर्द होने लगी, and it turned out to be DVT. But मेरे बेटे ने देख लिया, and I was in hospital. Then I was on Coumadin, and you know,
Yes,
so I mean, when you sit in the Mata ki chौकी जमीन पे, I still sit, but you just have to move little bit, you know.
You move like, change your thigh and change your calf position, and after 1 hour just go around, have some tea, have some snack, talk to the people. So whenever it's over an hour something, just take 5 minutes out. जैसे mindfulness में 1 घंटे के बाद में हमको दिमाग को दूसरी डायरेक्शन में लाना, अगर दिमाग ठीक से काम नहीं कर रहा. So this is very important कि आप
so
एक
he
जगह.
saved my life because he was in medical
my
college.
God.
उसने देखा, टच किया लेग को, immediately मेरे को Glencoe hospital में I went there.
Yes, you know, at that time we were giving heparin. इंजेक्शन लगाने पड़े होंगे, है ना?
इंजेक्शन लगाया, फिर I was on Coumadin.
Coumadin. And Coumadin is not an easy drug to take. You have to check your blood, because if you don't check your blood and don't restrict your salads and you know vitamin K intake, उससे तो फिर इतना dangerous था कि you have a chance of bleeding.
जरा सा चाकू लग गया तो blood सारा निकल जाएगा आपका.
Exactly. So I'm telling you, everybody.
Yeah. I am so happy कि आप leg
I
pain
am
का
so
ये topic
happy
लेके आए.
too. I'm so happy. Jyoti ji, not for you, for us, that you are good looking and you are smiling still. So ये क्लॉट की क्यों डेंजरस क्यों है ये क्लॉट, आप बताइए. अगर हम क्लॉट का केयर नहीं करेंगे ना, जो क्लॉट होते ना, when it is forming, top of it is very fluffy and superficial, that can dislodge, break from the main clot and travel into our lung, because the blood is going back to the lungs. And if the clot goes into the lung, Again, some people have no leg pain, very rarely. All of a sudden you are very short of breath और आपको रिप पेन हो रही है और मैं सांस ले रही हूँ और मेरे को बहुत रात को सोते सोते दर्द होगी. बहुत कॉजेज है उसके, लेकिन दिस इज वन ऑफ द कॉज कि आप ट्रेवल करके आए हैं, कोई लेग पेन नहीं है, थके हुए हैं, एकदम से सांस नहीं लिया जा रहा. सो you could have thrown a clot into the lungs, serious condition. Hospital right away. Urgent care भी जाने की जरूरत नहीं है अगर आपको ब्रीदिंग की तकलीफ है और चेस्ट में पेन है. It could be a clot gone into your lung. So just these are the small things, not small things, but urgent thing. So हम चौथी जो हम बात ये सर्कुलेशन के बारे में कह रहे हैं, very rarely as we age, sometimes there's no good arterial circulation, again peripheral vascular disease. It can, arteries can also have a clot. Arterial clot में क्या होता है, आपका foot एकदम से white हो जाएगा because there is no blood going into the foot. And white leg, pallor, pallor mean pale, white, no sensation, सुन हो गया पैर बिल्कुल. It's not necessarily a stroke. It is that you may have an arterial clot. Totally numb, pale, ऐसे लटक गया जैसे पैर. So, again, it's an emergency because if we know it's a clot, they can quickly take out the clot. It's something like stroke. If you realize that you are having a stroke, जिसमें कि आधा हाथ पैर दोनों numb हो जाते हैं, within 72 hours, they can find where the clot is with special tests and they can dissolve the clot. After 72 hours, those things don't work. So all these important emergencies are very important कि आपका अगर पैर एकदम से सुन हो जाए और कुछ उसमें sensation भी नहीं है और pale हो जाए, no circulation. I don't know how many of you know how to check the circulation in the foot. Right in front of the foot, between the big toe and the second toe, there's, if you put your fingers, it's just like a radial pulse. हम यहाँ पे check करते हैं, पैर में भी pulse होती है. तो वो अब जब आप रेगुलर चेकअप के लिए जाते हैं, आई नो दे चेक इट ऑल द टाइम. सो वो फुट के लिए होती है, स्पेशली डायबिटिक पीपल. दिस इज वेरी इंपॉर्टेंट दैट यू कीप an appointment with the regular doctor, and nowadays they go to the podiatrist. So keep your feet clean कि आपको infection ना हो toes में, and we don't have to do further problem. तो diabetic patient, hypertensive patients की arteries narrow हो जाती हैं. तो चलिए, अब आर्टीरियल सिस्टम खत्म हो गया, अब जल्दी से हम नर्वस सिस्टम पे आते हैं क्योंकि हमारा टाइम तो भागता ही जाता है सर. तो हमारी नर्व्स क्या करती हैं? नर्वस पेन, नर्वस पेन को बोलते हैं नर्व पेन, नॉट नर्वस पेन. नर्वस तो है ही, अगर आप नर्वस है, आपकी रेस्टलेसनेस है, तो सारी बॉडी में दर्द होता है. नॉट जस्ट द लेग्स, द होल आर्म्स आर टायर्ड, द नेक इज टायर्ड, बिकॉज नर्व्स आर कनेक्टेड फ्रॉम योर ब्रेन, फ्रॉम द स्पाइन, the whole spine in the back, and then the main spinal cord divides into two nerves. और वो जो नर्व होते हैं ना, उसको बोलते हैं sciatica nerve complex. उसके अंदर पता नहीं कितनी, एक कॉम्प्लेक्स में, एक इधर लेग में, इधर, तो दोनों लेग में डिवाइड हो जाता है. Then there is a center. If the center is getting pressed, you will have pain in both legs. But if they are all going through the hip bones, अगर एक हिप बोन खराब है, आर्थराइटिस या degenerative changes mean with the age the bones get decalcified और बढ़ जाती हैं, वो नर्व पे प्रेस करती हैं, तो एक लेग में भी पेन हो सकता है. So pain could be in both legs from the spine cord, it could be in one leg, and the pain from that nerve coming is usually very dull. It is like क्या हो गया, मेरे पैर में है, कभी खाली थाई में है, कभी ये भी है, तो हम सोचते भी नहीं है कि ये बैक से आ रही होगी. Only when you go for a checkup, they ऐसे ऐसे आपको मारते हैं और आपकी टांग को ऊपर करके देखते हैं कि आप टांग नहीं ऊपर कर सक रहे. It's coming from your thigh. So then they call it a sciatica pain. Then you go to MRI of the lower spine and the hip and find out what is sciatica pain. Some people एकदम से bend करते हैं. If they bend, the bones get caught with each other. उनको इतनी severe pain होती है, they cannot even get up. So once you know your body कि ऐसे होना है, तो you should be prepared and bend with your knees, not with your spine in the back. जो भी कुछ भारी उठाना हो, नीज को बेंड करके उठाइए, even at the young age. तो अब अगर आपको नी की प्रॉब्लम है तो आप क्या करेंगे? You know, knee arthritis is very common. Somebody told me we have to do the arthritis session again, Jyoti ji. आपको
sure.
arthritis पर पूरा अलग से
Let's
बात
go
करेंगे.
next time. Yeah.
अभी I just heard somebody have knee pain. तो उसने परवाह नहीं करी है ना, क्या है पेन ऊपर नीचे जाते होती. All of a sudden she woke up in the morning with swollen knee. इतनी swelling हुई कि she could not even walk. And that can be happening from bursitis. In this weather हम लोग एक्सरसाइज करते हैं, चलते हैं. चलना बहुत अच्छी बात है, लेकिन अपनी लिमिट में चलिए और देखिए कि जब भी आपकी टांगों में दर्द हो रहा है, रेस्ट करिए. Wear good sneakers like Jyoti ji. Wear good socks, comfortable clothes, not like some of the people who wear heels and they walk. So just be careful. Adjust to your body is so important. So हमने foot pain, leg pain, hip pain, pelvic pain हमने अच्छे से cover कर दिया because all these are connected. So neuropathy ऐसी condition है जिसमें आपकी nerves जो होती है ना, उनकी जो कवरिंग शीट होती है ना, वो थोड़ी ओल्ड हो जाती है. डीमाइलिनेशन बोलते हैं. डायबिटिक पेशेंट्स गेट सो बर्निंग पेन इन द फीट एंड आर्म्स आल्सो. उसके लिए आपको न्यूरोलॉजिस्ट के पास जाना पड़ेगा और मेडिसिन लेनी पड़ेगी. सो इसी के साथ हम आज का ये इंफॉर्मेशन थोड़ी सी जो हम आपको देते हैं, प्लीज आई होप इट हेल्प्स. इफ यू हैव एनी क्वेश्चन एनी टाइम यू आस्क, we will answer on the Facebook. We can answer on the phone, any way you like it. Just be informed. Information is very important these days. So hopefully we will have healthy legs and we'll take care of ourselves. Thank you.
Thank you, Jagji. हाँ, Facebook Live पे जस्सी आनंद जी हैं. She is saying this is great. Thank you for sharing. And then Neena ji कह रही हैं sometime no pain at all. Summertime no pain. Stretch, exercise help. बिल्कुल ठीक बोला. स्ट्रेच सबसे जरूरी है. स्टिफनेस भी आ जाती है बॉडी में एज के साथ, जो मेरा एक्सपीरियंस है. तो स्ट्रेच बहुत जरूरी है मॉर्निंग में. यू कांट जस्ट जगजी कि आप वॉक करें और स्ट्रेच नहीं करें. थोड़ा योगा करना चाहिए, स्ट्रेच सुबह करना चाहिए. सारा दिन आप में एनर्जी रहेगी. एंड देन थोड़ी वॉक भी करनी चाहिए. सो एज यू नो दिस आवर इवेंट इज हेल्थ इज वेल्थ. सो इन्वेस्ट इन योर हेल्थ. एंड इन्वेस्ट आप ऐसे ही कर सकते हैं. अच्छा खाना खाएं, एक्सरसाइज करें, स्ट्रेच करें, अच्छा सोचें और अच्छे लोगों से मिलें और पॉजिटिव एनर्जी अपने आसपास रखें. तो जग जी, आपका आज का सेशन बहुत अच्छा था. और नेक्स्ट टाइम लेट्स डू you know same kind of arthritis पे करते
We
हैं.
can do arthritis, we can stress more on the joints and the bones. आज हमने regular, just general like pain की बात करिए. There are so many reasons. But just remember, if you see something all of a sudden and so severe, do not wait. अगले दिन तक की वेट मत करिए. तो ठीक
तो
है.
लेग में पेन नहीं होनी चाहिए. आपको जो लाइफ मिली है, आप बहुत अच्छे से, बहुत हल्की रहनी चाहिए लेग्स. अगर पेन हो रही है तो जरूर कोई रीजन है उसका, तो उसको रीजन को ठीक करिए. एंड देन रन, एंजॉय योर लाइफ. अगर टांगे नहीं है तो आप कुछ नहीं कर सकते. आपको जिंदगी में भागना भी है, चलना भी है, खड़े रह के खाना भी बनाना है. लेडीज के लिए तो लेग्स बहुत जरूरी है. कोई भी प्रॉब्लम हो, मैं ये कहती हूँ हर चीज का इलाज है. सो इफ यू जस्ट डू समथिंग, डॉक्टर जग को फोन कर लीजिए. शी कैन गाइड यू. शी इज आवर फ्रेंड. एंड देन शी कैन गाइड यू किस डॉक्टर के पास जाना है, क्या करना है. अब जस्सी आनंद कह रही हैं कि मैंने अपनी मम्मी को भी मैसेज कर दिया. शी विल जस्ट ट्यून इन. वेरी गुड. अगर यंग लोग देख रहे हैं तो अपनी ग्रैंड मदर, अपनी मदर्स, सबको बोलिए ये देखें. और देन दे कैन टॉक टू द फैमिली इफ दे हैव एनी प्रॉब्लम. अगर जगजी ने कुछ बताया है, ऐसे हो रहा है, वैसे हो रहा है, सो इट कैन हेल्प लॉट्स ऑफ पीपल.
Yes, absolutely.
Yeah.
Absolutely.
जगजी,
Thank you, Jyoti.
बहुत अच्छा सेशन गया. थैंक यू वेरी मच. और
तो चलिए गाना हो जाए जल्दी से.
हाँ जी जगजी, गाना. अच्छा चलो, मैं 4 लाइनें सुनाती. म्यूजिक के बिना तो
दो चार जो भी हमारे को अच्छी लगती हैं.
आजकल बाहर इतने बढ़िया हो रहा है, कलर्स वगैरह सब आ रहे हैं, तो मैं 2 लाइनें गाती हूँ. निंदिया से जागी बहार, ऐसा मौसम देखा पहली बार, कोयल कूके गाय मल्हार, निंदिया से जागी बहार, ऐसा मौसम देखा पहले।
आएगा आएगा आएगा, वो मौसम भी आएगा।
हाँ जी
बाहर
जबकि अब आप भी
आएगा।
कुछ सुना दीजिए। या
चलिए, हम आपके लिए और बाकी सब सुनने वालों के लिए, देखने वालों के लिए ये 2 लाइनें। एक मंजिल राही दो, फिर प्यार न कैसे हो, फिर प्यार न कैसे हो। एक मंजिल राही दो, फिर प्यार न कैसे हो। साथ मिले जब दिल को, फिर प्यार न कैसे हो, फिर प्यार न कैसे। नेक्स्ट टाइम विद द म्यूजिक, ज्योति जी। एंड अब प्यारा प्यारा साथ मिले आप सब लोगों का, तो फिर प्यार तो होगा दर्शकों से भी और साथियों से भी, फ्रेंड्स से भी। So let's have a great day today. It's nice outside. Forget सब चिंता और चलिए स्नीकर पहनिए और घूमने जाइए। Have a nice day.
जस्सी आनंद जी पूछ रही हैं, do you have these sessions on a regular basis? Yes, Jassi, we have every Thursday at 11 a.m. Facebook Live on Health is Wealth page. So every Thursday, we used to have every Monday at 12:30 p.m. But now we change this time on everybody's demand, on our convenience also. So every Thursday 11 a.m. with a different topic, health is wealth. Okay. So thank you everybody for watching, and wait for the YouTube video, and any questions you can write on this page. Thank you very much. Namaste. Thank you, Jagji.